fact in the country to be precise. But in the last 24 hours, and it was a Sunday yesterday, we've only done 5 lakh samples. That is nothing. If you look at the increasing graph of the number of cases, you need to test more, you need to continue to isolate more, you need to keep the patients in isolation so that the cases do not multiply. But if you do not test enough, how will you know? Asymptomatic cases and asymptomatic patients are also driving the pandemic, and that has been a concern as well, particularly in Maharashtra. Now, like I mentioned at the very outset, today is Women's Day, International Women's Day, and today I really want to touch upon the role of ASHA workers and Anganwadi workers in the country, who have been working tirelessly over months and years together. More so during the pandemic, they were the ones who were ensuring the last mile connect when it came to talking to people, counseling them during the COVID-19 pandemic, even going on to the extent of monitoring, door-to-door monitoring of how people are feeling, who's feeling unwell. They've done their bit really in the country, and today is the day to in fact felicitate them and talk about their contribution. They are the ones who've been at the forefront of every healthcare program in the country, be it the integrated children services for which meals are provided to children, the child development services, or be it workers, the Anganwadi workers during the midday meal, when the midday meal scheme it was functional. It still is functional in many parts of the country, though many schools are still shut right now. But they have done a lot of work, and many times small things, them not being paid on time, for example, they do say that our concerns do go unheard, and maybe this is the time really now to talk about their contribution. Experts say that the positive effects of the work done by these women is evident, and I'm reading from what the UNICEF has said. From the declining mortality among infants in India, in children and new mothers in the country, UNICEF has called them instrumental to child development for the role they play in fighting malnourishment. I'm actually reading out from the report of UNICEF. In fact, Anganwadi workers, ASHA workers of the country, they in fact say that they're really the army of women who are the backbone of the healthcare drive in the country against infection. So essentially the backbone of India's healthcare system, and these are the workers there. So we need to in fact take a moment to in fact thank these workers and look at their contribution for what they do for us, because all has been said about everything being in a digital form, the CoWIN app, the CoWIN software, but the strength really is in these grassroots workers who move from one house to the other, one location to the other, ensuring that children get their vaccines, pregnant women get the care they need. All of that has been taken care of by the network of ASHAs and Anganwadi workers in the country. The more you speak about their role and their contribution, the less I feel, because there is just so much of contribution to the country's healthcare system that they really need to be acknowledged. Today, again, like I said, because it is International Women's Day, it's time to sit back and think about the kind of problems women have faced, not just in the last 1 year, but in general, their health problems, their health concerns. Lots of problems that they faced during the pandemic. Maybe time to talk about that. Non-availability of sexual reproductive healthcare services, movement restrictions, travel bans, lockdowns, creating mental issues for women confined at home, domestic abuse that they have faced throughout the last 1 year. They anyway face this abuse, and this has in fact increased multiple times in the last 1 year, given the fact that they were confined at home and were constantly at friction with their partners, with the rest of the family members. Many in fact have felt depressed. Many have come forward and spoken about mental health care issues. The WHO in fact has spoken about the fact and has done a worldwide survey in which 62% women say that they do not have the time to monitor their health. No matter what you do, no matter how much you earn, no matter how much work in office or whatever profile you have in your office space, or what is getting neglected is your health, and this is something that the WHO is trying to underscore. According to doctors in Vidarbha, for example, Vidarbha is a place in Maharashtra. This number could be more in the region because most rural women say that they do end up neglecting their health. This is in fact happening in a place like Vidarbh. It's a rural area. 90% of women here are saying that they do not take care of their health. This survey was done to understand how many women are actually registering their problems, going to a doctor when they're not feeling well, or they're brushing their complications under the carpet. There's a cancer registry, and this study has been done in the Nagpur region, which says that most cases of cancer were in women, confirmed in the last 2 years. 50% of them were in women. About 30% of women patients have breast cancer. Many of them are in the last stages of cancer, but they neglected earlier symptoms and ended up sitting on their problems, sitting on their issues, the kind of health complications they were facing, and hence the disease progressed, and the situation that they are in right now, it's irreversible. Arthritis is common in women. In fact, as compared to men, both lupus arthritis is 9 to 15 times more common in women. Also, osteoporosis and osteoarthritis is 2 times more common in women than men, is what doctors are saying, that these are problems that if you do little things, take care of yourself, listen to what your body is saying, it can be taken care of, but women are not doing it. These are problems that women in fact are not looking at. They're also not taking care of the diet. There is a problem of high sugar intake, which is linked to increased appetite and weight, and all of this is because they are simply neglecting themselves. I mentioned already how during the pandemic all of these problems just multiplied. The pandemic continues, but the lockdown essentially we've opened up in a big way, so women essentially are out of home, but these problems multiplied, I beg your pardon, during the pandemic. Time maybe to look at these issues. Get your test done for cervical cancer, get your test done for breast cancer, especially after the age of 40. Take care of these problems, because once they surface, and if you are in the last stages of cancer, then it becomes a huge problem. In fact, a lot of doctors do say that many of these things can be taken care of at the very onset of the infection. So if you can, and if your time allows you, you must in fact even take out time to get these regular health checkups done. As far as rural women are concerned, they do not have the advantage of sophisticated healthcare checkups. Whenever you can, if your body is signaling you that there is a problem, then listen to what your body essentially is saying. I think that is the message for all women, including myself, this Women's Day, that everything else can wait, but health must be prioritized for you, for yourself, because there are many more problems that women face but men don't. Not saying that men do not face health issues, but cervical cancer, for example, breast cancer, weight gain, obesity, these are many problems that women face because of lifestyle issues, and small changes here and there, taking care of yourself, like I said, listening to your body, will actually go a long way in addressing these problems. Thank you for joining in.